What's up, world? Uko here from Better Therapy Now. Do you have to talk about your childhood in therapy? And the answer is no, but it's surprising. And I think a lot of this is from the influence of Freud and maybe Carl Jung and how popular they are. Is that a lot of people will come to a therapy session and immediately start talking about their childhood, and they've made all these types of connections. And s- find myself doing a lot of reality testing and kind of identifying like inconsistencies in what a person is talking about because they've done so much like reflection and thought themselves. But at the end of the day, you don't have to talk about your childhood in therapy. And honestly, most cases, it's best to talk about what's going on right now because the biggest reason, the most important reason that somebody brings up childhood in individual therapy is to identify how things that have happened in their childhood are impacting their behaviors today, like right now, and identifying where they learned certain behaviors from. Most likely, it's in childhood, and by childhood, I mean 18 years and younger. So it could be like in their later teenage years, maybe even in their young adult years, where those thoughts and those behaviors that were modeled for them, or that they've learned, or that were positively reinforced, kind of solidified in their brain, and especially with the fact that the brain doesn't really stop forming and developing until close to your mid 20s, especially for males. People could have learned certain behaviors in their early 20s, and that might be the topic of conversation in most individual therapy sessions. Or you may just be talking about how to navigate certain issues and certain challenges now. But I do think childhood is a good place to go just because that is the most likely spot that people have learned a certain behavior that they're trying to better understand or overcome. A better question to think about is, should you talk about childhood in therapy from the beginning, or when is a good time to talk about it? In the beginning, most likely talking about childhood is not the or getting really in depth about childhood is not the best thing. Usually when you meet with an individual therapist, I would say the majority, like 70 to 80%, will do an initial assessment and a treatment plan in that first meeting. Sometimes you will do it with an intake therapist or intake clinician and then go to your normal or your regular therapist. And then sometimes your regular therapist will be the one that does that assessment and treatment plan. And in that assessment, they will ask questions about childhood, certain things like, were your parents divorced? Were they married? Were they neglectful at all? They won't necessarily ask you to go into depth with these topics because going into depth with them can cause a whole lot of triggering episodes. It can bring up a whole lot of very difficult emotions. It can kind of open up Pandora's box, and then it would be very hard to bring a client down so that they can go back out into the world, like live their normal life. You want to do a really good job, or a therapist wants to do a really good job of building rapport with a client and then slowly touching on difficult topics or childhood topics that may be traumatic as they're meeting week to week and developing that trust. The thing that you have to talk about is yourself. So, a lot of the times, the therapist will guide a client back to talking about how they feel about the situation or how they are impacted by maybe somebody else's behavior. And I guess it's not necessarily a tug of war, but for example, if a client is talking about like how their partner is annoying them and they're talking about kind of the behaviors of their partner, it's the therapist's job to bring that back to the client and talk about how they're impacting the situation and how they can impact the situation. And that's a lot of the work in an individual therapy session, reflecting on how the client is reacting to their environment and how the client can impact their environment. And then, if it's necessary, like if there are certain behaviors that a client is doing that they just don't understand or fully can't manage, then maybe childhood issues or upbringing or childhood topics will be necessary. But in every session, and honestly, with every client, it's not necessary to talk about childhood. And the topic of childhood is not guaranteed to be necessary for an individual therapy session or in the entire services with your therapist. I'm Uko from Better Therapy Now. Thank you for watching, and I'll see you next time.